start. Good morning, good afternoon, good evening. Welcome to this panel at the UN World Data Forum that has been organized by the Swiss Agency for Development and Cooperation. Many of you know the SDC. And we are going to have a focus on strong data governance for health, also building on the experiences that many countries and individuals have had around the pandemic and COVID-19. But of course, if we just think of the last few days with the breakdown of Facebook and WhatsApp and the whistleblower events around Facebook, we got an additional understanding how important strong data governance is in general, and then for health in particular. We will have a keynote speech and then contributions by a range of panelists who I will then introduce as we move forward. Of course, this discussion takes place in the context of the Sustainable Development Goals, the fear that through the pandemic, particularly in health, we will not be reaching the development goals for health. There is big concern. And there is, of course, also a hope that at least some of the developments around digital health will allow us to address some of the gaps and some of the issues. And of course, the greatest concern here is in relation to inequity in health. And we see that inequity in health now comes together and can be reinforced through inequity in access to digital connectivity. So we are seeing two determinants of health actually come together, the social determinants of health and what we now call the digital determinants of health. And I hope all of the participants will also give us an idea how an improved governance and improved data governance can actually help us bridge some of this divide. Another point we hope to address, because this is organized by the Swiss Development Agency, is the fear and the reality, I should say, of an increasing fragmentation in the field of digital health. I co-chair a Lancet Commission on Governing Health Futures. We did a survey of how development agencies are supporting digital health projects around the world. And the key impression that we got from this was one of fragmentation, of not being fully linked to the establishment of universal health coverage and primary health care. And you get what some of us call pilotitis or projectitis or whatever. So we will take up many of these issues as much as you can in 1 short hour. We'll see if we have some time to also respond to some questions. And we hope that at the end of the session, we have a better understanding of how to invest in robust data governance systems and stewardship. I'd like to add an advertisement here. I mentioned the Lancet Commission on Governing Health Futures. We will launch the report of this commission on the 25th of October, and I think it will also be an interesting input that you might want to look at as a follow-through of the discussions here. So to begin, without further ado, I'd like to call on Professor Antoine Geissbühler, who is Vice-Rector at the University of Geneva, has long-standing experience in digital, in telemedicine at the University Hospital, together with colleagues all around the world. He is in charge of innovation and digitalization at the University of Geneva, and he will set the scene for our discussions. Professor Geissbühler, Antoine, over to you, please.
Thank you, Ilona. Thank you for the opportunity to share some thoughts And I'm coming here today as I would say, a practitioner of digital health. As Ilona mentioned, I've been involved in this domain for the last at least 30 years, building systems for hospitals, for regional systems, but also developing networks, in particular in sub-Saharan Africa. And so the idea is really to illustrate some of the issues related to data governance, and maybe illustrate that also to the acceleration of our understanding of those issues related to the COVID crisis. And most of you know those curves and reflect on, you know, how fast this has happened, how much we had to adjust, and how much we've learned from the different phases, which are obviously different in different countries. I think if we try to reflect on what we've learned about data governance from the COVID-19 crisis, are things that we probably already knew before, but that became very obvious. One of the key acronyms that I'd like to introduce here is FAIR. FAIR is a concept that comes from open science in particular, and understanding that, you know, if we want to learn from data, we need to make sure this data can be found, it has to be findable, can be accessed. Not freely accessed, but accessed. It may be subject to some protections, some restrictions. It has to be interoperable, which means that all the parties that have access to this data need to understand the meaning of this data, and this is particularly important if you want to have computer systems dealing with the data, the analytics, and everything. And it has to be reusable. That's a fundamental idea, that the data that we produce has value if it can also be reused by others or by ourselves in different kind of scenarios. So I would say that, you know, the COVID-19 crisis, with the need, the necessity to have access to data to understand the situation. Remember, even in a very developed country like Switzerland, a lot of information was exchanged by fax machines in the early days of the pandemics. That has evolved quite rapidly, but just to show it's really when you need the data that you realize how much you haven't progressed on the fair aspects of this data. I think another issue that has become very much discussed is the balance between privacy protection and use or reuse of data for decision making, for policy making, and basically considering that this data is a public good in many circumstances, and this balance is very hard to find. And I think we have these issues, as we discussed, you know, the COVID pass and what it should contain as information, where it should be stored, who should have access to it, and this tension is a tension that we see in many dimensions. Another issue is data sovereignty, and sovereignty can be understood at different levels. It can be the data that we manage has to be managed according to the laws of our country, for instance, but it also me as owner of data, my medical data, for instance, I should be sovereign. I should be asked whether I consent or not to give access to this data, and that remains a significant issue, and this is particularly a significant issue in lower income countries, where the ability to actually manage this data, to host this data, to secure this data is an issue. I think another thing that we've learned is, we've exemplified during the crisis, is the fact that there is this thinking that, you know, we can represent reality in the digital world. That, you know, if we have enough information, then what we represent in the digital world is matching what is happening in the real world. And if we take the example of those applications that were supposed to detect contacts and warn us and change our behaviors, then we realize how far from reality the digital understanding of the world was, and that probably explains part of why these applications were not so successful. And so what we've learned is that at some point, when you build those tools, it has to be built with people, it has to be constructed also taking into account human factors and societal factors. And then probably the last thing, I mean, it has been a tough ride, but in the at least the early phase of the COVID-19 crisis, as we experienced it in a hospital, University Hospital in Geneva, we were able to do things that we just thought were impossible. You know, in my domain, I've been struggling for the last 20 years deploying telemedicine in the hospital. In 2 weeks, we had to deploy 400 telemedicine stations just because we couldn't admit outpatients anymore for a few weeks or actually months. And so we've also learned how it was possible to distribute decision making, how it was possible to shortcut in the red tape and paperwork. And the question is, you know, how can we actually sustain this? Because we know it's possible now. We've been through it and we've experienced it. It's no longer something that we fancy. It's something that we know is possible. How can we sustain? So those are the kind of questions that we need to ask. And just to tell you some of the impact it has. So in our hospital, we were just before the crisis in the planning phase of the strategic plan for the hospital. And we realized that we were not able to pilot in real time with data our hospital. And in particular, not because we didn't have the data, but because some of the data was not fair, but also because we didn't have the feedback mechanisms to understand the problems, to solve these issues, to implement them, and then to measure the impact. And so one of the key outcomes of the COVID crisis is really to rethink how we can pilot a large healthcare organization with real-time data. There's another large-scale project in Switzerland dealing with biomedical research. It's called the Swiss Personalized Health Network. It existed before the COVID crisis, but I think it has exemplified why it's so important to build infrastructures that enable nationwide use and exchange of health data for research. And that's precisely what the Swiss Personalized Health Network is doing. And I think the COVID-19 crisis has put more visibility and probably put this kind of effort on a more understandable political agenda for Switzerland. Now I'd like to move to some of the experiences we've been having in developing countries, and this is a project that we've been involved with Terre des Hommes, who's been deploying a tool for the integrated management of childhood illnesses in Burkina Faso, and deployed at a sufficiently large scale that it's now producing hundreds of thousands of consultations per month. And so that's producing a lot of data, what we call big data. And the idea was to understand how we can create new mechanisms for analyzing this data using artificial intelligence in particular, and how this can drive new mechanisms for improving the processes in healthcare. And I think Dr. Ouedraogo is actually part of the panel, and hopefully he will talk about this. But really what we've shown is that there is ways to do clever, targeted, in-service capacity building based on the analysis of this big data. And we've also shown that it's possible to do relatively short-term, precise prediction of some diseases, here in particular the risk of malaria epidemics, and therefore help the health system to adjust and to prepare for what is coming based on the data that's collected on the ground. And I think those are very promising examples, and it's probably more than an example. It's one of the few projects that has been deployed at almost national scale. I'd like to, as we're talking about governance, and I think this is a hot topic. AI, artificial intelligence, is seen as a tool with many promises of how it can help us understand, deal with data, help with decision-making processes. And it's clear that AI can augment the capacities of healthcare professionals in various domains. What is also interesting, and that's things that we start to experiment with, is how much this can also help patients or citizens to understand their health issues and make choices about how they want to be managed. But it's also important, and that's the real governance issue, to realize the limits of AI and to manage them. And I think there are some principles that we really need to put on the table as we talk about artificial intelligence. It's the principle of benevolence. First do no harm is what we learn in medicine, and vigilance, and understand that those algorithms need to be watched carefully. They may contain biases, they may contain other forms of problems that will actually change their behaviors in unwanted ways. It's also an issue about educating not only professionals but also citizens. One of the key issues we have with the current technologies using AI is the fact that their algorithms cannot explain their reasoning, and therefore you have black boxes. And so making algorithms understandable so that we can really have this mutual understanding is extremely important. We need audit and certification mechanisms, and we have to realize that those tools are likely not only artificial intelligence, but digital health tools in general are going to change the way the professions, the roles of the different professions are organized in health systems. That's something we need to be prepared for. I just wanted to finish with some practical experiences. We've been working for 20 years on this RAFT network, de-isolating care professionals working in remote places. I don't want to get into the details, but just some of the lessons we've learned is the importance of education. It takes years to train a physician to really understand the issues of digital health if we want this person to be a leader in that domain. We've currently very proud to have the first full professor of medical informatics in French-speaking Africa from Mali. He trained with us for 10 years. That's the kind of investment that we need to attain those results, and to make sure that those who then are trained are able to lead their own research agendas, to get their own funding, and to be independent, even though we obviously stay connected. And Ilona mentioned pilotitis. Yeah, I'm almost done. You mentioned pilotitis, Ilona, and I think this is one of the key issues for governance. I think the Ugandan government in 2012 took a very bold decision of a moratorium on e-health initiatives. I'm not sure how successful this has been, but this is a strong message that if we want those systems to work, they need to be aligned with the national strategies. They need to be managed by the government so that they can actually scale, reach a significant activity, so that they can also demonstrate their usefulness. And one of the tools that we recently set up with the help of the SDC to address those implementation and evaluation issues is the Geneva Hub for Global Digital Health, the GD Hub. You have the website here. This is really a tool that should help catalyze understanding, sharing of information, helping finding the right people to talk to when you implement systems, enhance collaboration, and promote exchange of knowledge. And with this, sorry if I've been a bit too long, but those were some thoughts and experiences I wanted to share to introduce the discussion about governance. Thank you for your attention.
Thank you very much, Antoine, and thank you for leaving us with a couple of things. First, a new acronym, FAIR, which I think can be very helpful. And I saw a new word, implementomics, dealing with complexity. And of course, that's very clear in this area. But quite seriously, what you have indicated is the real importance of governance principles. And we're seeing that this is being worked on in a number of areas. And I'm sure our WHO representative will come back to that afterwards. It's my pleasure now to give the floor to Ambassador Christian Frutiger, who is the Assistant Director General and Head of Global Cooperation at the Swiss Agency for Development and Cooperation. And he will share with us some of the perspectives of a development agency that is entering this field of data governance. Please, Christian, over to you.
Thanks a lot, Ilona, and thanks to Professor Geissbühler for these introductory remarks. So you see around me the panel is setting up, so we're all taking our seats. So I'll start with a few points, and I think we can continue the discussion. Well, yeah, data for better lives. Actually, the title of the latest World Development Report of the World Bank, which came out just a few weeks ago, and this is really what we're looking at here. Huge progress has been made over the last decade, in particular also in low and the least development countries, and of course in middle income countries. The use of smartphones has been a quantum leap with spectacular impacts literally anywhere in the world. However, the same World Development Report of the World Bank also shows that the digital divide is still hugely present. We actually have close to 4 billion people with mobile network coverage, but who are unable to access those networks, unable to go online due to basically the fact that they cannot afford it, or due to simple literacy on how to do that. COVID-19, and Professor Geissbühler has shown this very impressively, has accelerated this movement towards digitalization, towards use of health data as well, with enormous potential for positive impact to improve the quality, the efficiency, the safety, the speed of healthcare services. This all accelerated or underpinned by the huge opportunities through artificial intelligence. But then again, the digital divide, people not being able to actually make use of data, people not being able to access them. The FAIR principle is really very important. The ownership of data, the biases that can be introduced into artificial intelligence, all the way to ethnic biases, racial biases that can lead to all forms of discrimination, and have actually been used by some governments throughout the pandemic. The fragmentation, the far west of digital health is really a challenge. Pilotitis everywhere in the world, in the north, in the south, in the east, in the west, which is spectacular. So some order will have to be put into that. So what this all calls for is that the community of states stick their heads together, that we take our responsibility to work on regulation, to look at international alignment and strategies in order to really bring all this together. So better data for people and better data for better impact on people. So in the end, better data for better life. So again, the World Bank report, I think, is spot on. Putting it into practice is another challenge. So back to you to see how we do that.
Thank you very much, Christian. And I'm delighted that we have Dr. Samira Asma with us. She is the Assistant Director General for Data Analytics and Delivery for Impact at the World Health Organization. And there is no better person, I think, to speak to us about the initiatives on international cooperation, global normative and legal frameworks and governance. She herself has been organizing a number of conferences around this and expert meetings, and of course no better place to set norms for the governance of health data than the World Health Organization. So Samira, we're delighted that you are there in Bern, even though I can't be there, and can share some of that WHO work with us. Please, over to you.
Absolutely, and greetings, colleagues. Ilona, we miss you here personally, but I think the virtual world connects us distantly and bring us all close together. First of all, I would like to thank you, Ilona, for moderating this session. There is no one better who could tackle this complex topic, as well as would like to acknowledge a Swiss agency for development and cooperation for hosting and having the vision from Geneva to Road to Bern, or from Cape Town to Bern. And I think the several milestones that are leading us towards a better data and digital architecture underpinned by governance. I will begin by saying that when Dr. Tedros took office, his vision was and is to transform WHO, to make it a truly modern, data-driven organization and meet the SDGs. COVID has truly re-exposed the various data fragmentations, not only limiting data sharing, information and intelligence sharing, but many other sharing when we talk about even equities, vaccines, that is unfolding in front of us. We are truly at a tipping point. We have a choice either to go back to the pre-pandemic days, which we cannot afford, or we move forward in a very bold way to make data truly a global public good. And to do this, having a strong foundation of governance is going to be important, where data is truly effective, it saves lives, it promotes health, it is efficient, and it is equitable. So these are the three fundamental principles for data governance. We just concluded the second Data Governance Summit last week, and we brought together global experts and institutions to discuss how we take the data governance from a conceptual and theoretical framing to truly operationalize it for research and clinical trials and for public health and disease surveillance, and also what are the legal and ethical considerations that underpin making data open for collective policy action, while at the same time safeguarding the privacy and ensuring the proper consents of the individuals. And there are already very good examples from a number of institutions. And WHO is forging forward to establish a World Health Data Hub, networking with all the data hubs. And Ilona has been also a visionary in also launching the WHO's hub of Berlin hub for pandemic preparedness that will truly forecast and help us to predict and prevent outbreaks from becoming epidemics and from epidemics to becoming pandemic. So without data sharing, gathering, as well as storing and using the data to drive impact, I think is going to be very crucial in the coming days, I would say, because we don't have time and we are less than a decade towards 2030, and we have already seen that we were off track, and as WHO strategy was to have at least 1 billion more people access universal health coverage without financial hardship, at least 1 billion more people living healthier lives, and at least 1 billion, but now the whole world better prepared from and effectively respond to epidemics and emergencies. This was the goal we established in 2018 to meet by 2023. We are way off even those targets. The idea was if we count everyone, we should be able to leave no one behind and accelerate our progress towards the 2030 agenda. So data governance becomes a crucial centerpiece, and we look forward to working with everyone.
Thank you very much, Samira. Thank you for highlighting particularly two things: the enormous urgency of this issue, and as we look into the real world and what we've been experiencing over the last year or two, both in the health world and in the tech world, reinforces that element of urgency for governance, and also the urgency of revisiting our universal health coverage concepts and strategies to make sure that they are fully linked and integrated with the digital transformation, and the governance issues that emerge from that. And just as we are looking for solidarity in terms of universal health coverage, our Lancet Commission has also put forward the suggestion of a new form of data solidarity that actually allows us to bring these various forms of solidarity that we need and the social contract we need together. We will now look at two country experiences, examples in relation to the governance challenge. And first we go to the host country, Switzerland. We have with us Dr. Sang Kim, who is at the Federal Office of Public Health. And Dr. Sang Kim was the head of the division Digital Transformation, and he's also a professor for medical informatics at the Bern University for Applied Science. And this is a very important thing because very frequently in health we talk about digital health, but what we're actually talking about is a larger digital transformation that impacts health and that can drive health in new ways. So, Dr. Sang Kim, please give us some of your thoughts from a Swiss perspective, how the issue of data governance can be taken forward.
Okay, hello everybody. Thank you for the invitation. Thank you, Ilona, for the introduction. Well, I was asked to talk about our experience and the best practice we made in the COVID-19 crisis. To be honest, I think everybody knows that we were not really well prepared for this kind of crisis. No one was it in our health system. And especially in terms of data governance, we saw that we have a real big lack of missing infrastructure, IT infrastructure, and a big lack of knowledge of the people how the data could be used. I'm really sorry to say, and maybe to disappoint you, that even in one of the richest countries of the world, here in Switzerland, we are not able to collect real-world data as we would like to. The major problem here is that there's no national data governance organization for that. We have several organizations, several people who are involved. And before this crisis, there were some plans how to be prepared and how to govern and how to contribute all these needed data for good reaction and for policy making. But in the end, we realized that we are doing a lot of things manually, as Antoine mentioned before. One short example, the faxes. That's true that in the beginning of the crisis, all the test results were sent and transported by the labs to the governmental bodies via fax mostly. And this is not because on our side, on the governmental side, we were not able to handle digital data. Okay, I'm honest. It was not perfect, but at least we had the chance to get the digital data from the labs, but they were not able to send them digitally in the first 2 months. And after we made the regulation, then we forced them to send all the lab result data digitally in an automated way. Why was it like that? To be honest, because there was no incentives before for the labs to do it digitally. And this is what also Antoine mentioned, the fragmentation of the health system, especially here in Switzerland, is so big. And we have so many heterogeneous players and so many stakeholders here, and everybody has to look at himself, because every of these organizations that are enterprises, and they have to think about, shall I invest in more digital tools or shall I not invest? Can I afford this? Do I have a return of investment or not? And until now, in our current health system here in Switzerland, we do not have a real incentives for investments in IT infrastructure. And so the governance issue is, in my opinion, that's my personal opinion, one of the biggest challenges we have here. What we would need here is a leadership a leadership, a clear national strategy, how to involve all stakeholders and how to make it happen and how to convince the people that we need a basic IT infrastructure for a better digitalization of the health system here in Switzerland. I've met some Finnish colleagues several weeks ago, and they told me that they had a 10-year plan for a national strategy of digitalization of the Finnish health system. And this is what I understand in national leadership. And they made it happen. Now they have really a basic infrastructure with several pieces, what you need, and tools, what you need to, for instance, make data interoperable. And you know, interoperability is one of the biggest challenges we have. It's not only the interoperability on the technical side, we also are talking about the level of semantic interoperability, where you need some coordination for that on nationwide, on international coordination as well. But the major challenge maybe is the interoperability on the legal side. So this is what I have experienced in the last 1.5 years. Thanks.
Thank you very much. And I think this is something we have seen throughout the COVID-19 pandemic, that many of the high-income countries were not that well prepared in relation to digital solutions and support around COVID-19 developments. And you've mentioned some of the points that are absolutely critical. It does need political leadership to take something like this forward. It does need a national strategy so that one can overcome fragmentation and bring the many partners together. And in doing that, one needs to build a reliable and sustainable and well-financed infrastructure. And this, of course, are general governance elements that become important in any part of the world. And it's interesting to see that in some of the low and middle income countries, they are actually several steps ahead with some of these components compared to some of the high income countries, also because they have more flexibility. You mentioned the enormous number of players and interests in a country like Switzerland in the healthcare system, and that in itself is an impediment to being able to move forward. It's my pleasure now to ask Dr. Boukari Ouedraogo to give us the impression from Burkina Faso, where he is involved as the Director of Health Information Systems at the Ministry of Health. Can you share the experiences from Burkina Faso with us, please, Doctor? Hello? We can't hear you. No, it's not working. No.
Can you hear me?
Now we can hear you. Yes, wonderful. Thank you.
Okay, thank you very much. I said thank you for this opportunity. You allow me to contribute, and also I will learn from other panelists. I think this term is very important in the context of COVID-19 in Burkina Faso, because it contributes to change the way of data is managed and used in our context. What we can share with you experience of Burkina Faso, according policymaker, legislator, and practitioner. In our experience, we did a mini effort because we have a cross-sector collaboration, but we try to capitalize and skills and knowledge. It is significantly, and it contribute significantly to reduce staffing and shortage. Also, in May, Minister of Health did a element of technical and financial partner, which we have to put in the same the Minister of Health vision that all partner technical have to align and also to avoid one challenging we have to face, that is the fragmentation of health information. And for legislator, we have to consider that the Burkina Faso have a new law for on the protection of person with regard to the processing and personal data. For this new law, Burkina Faso, we try to, with COVID-19, to do some experience with telemedicine. And with this new law, there are some constraints which oblige Minister of Health to host the data in Burkina Faso. And for this, we had to implement one platform with a big blue button platform. It is free for video conferencing because Zoom and Overone can not host it in Burkina Faso. And with this law, it is an obligation for us. And we think with COVID-19 help to improve the capacity of Minister of Health and government to improve the capacity to host data in Burkina Faso. And over topic that I can share also with the participant, we can talk about how we can help data can be better used for decision making. For this topic, we can say we can say that for evidence-based decision making, it is very necessary that health information is useful, and especially in the context of COVID-19. And for our context, we try to improve the quality of data collection and also timely and relevant and accessibility of information at many levels of health information system. And one of the big major challenges that we face is the fragmentation. And for this fragmentation, in my experience in Ministry of Health, some of key points we have to consider better use for decision making with health data is we have to simplify collection tools, because in health facilities, before we improve the digitalization, we have many tools that health workers use to collect and to transmit data. And we have to simplify these tools by focusing on useful data first on the collection sites. And also we have a mechanism. We have a mechanism to strengthen data management and analysis. And therefore, we think it is important to improve the level of data use and its effect on data quality and share responsibilities at different level of health system, which is an obligation of our new 2021 laws. Then to finish, we would like to talk about how the digitalization and data skills, awareness and literacies can be improved in our country, in country level. For that, we can say that it's very important to increase motivation as stakeholders will feel more confident and valued and motivated. And also, we think it is very important to continue the communication of awareness, but raising action, thus contributing to the valorization of health workers' actions. And to finish, we think it's very important to continue to emphasize on the decision making by frontline actors by talking about health workers in all health centers in Burkina Faso. That is the frequent that I think I can share with panelists and participants. Thank you.
Thank you so much for these insights. And we see that actually both a highly developed country and a country like Burkina, like Switzerland, and a country like Burkina Faso have both experiencing major problems with fragmentation. We've heard that from both sides. Both have challenges with the governance and the infrastructure. We heard from you, Dr. Bukhari, that that you have put in place a new law. We've heard from you the real importance of quality data. That is something we often don't talk enough about. And of course, the importance of combining the digital and the health literacy of populations and of health professionals to motivate them to participate in the system. So we see that we have a whole range of challenges that apply to countries all over the world. And I think that is something Dr. Asma would, I'm sure, also reinforce. We move forward now to hear from Claudia Juch, who is the Vice President of Data and Society at the Patrick J. Mcgovern Foundation. And from her, we hope to gain some insights how actually to develop data partnerships. How does one build collaborative efforts in this governance space? Over to you, Claudia. Can you share some experiences and insights with us?
Thanks so much, Ilona, and thanks for the organizers for inviting me. COVID-19 has clearly accelerated many things, as Professor Antoine Geissbühler said in the beginning, and the creation of and the emergence of data partnerships, I think, is one. Data partnerships between telecom companies and big tech companies and non-profit organizations and governments. And I think it has also highlighted the benefits and challenges of these partnerships. What is a success when it comes to answer the question how to develop a successful data partnership? What does success mean in this context? Clearly, ultimately, it means that a data partnership contributes to the delivery of high quality, accessible, and equitable care. But beyond that, at the Patrick J. Mcgovern Foundation, our emerging thinking focuses on three guiding principles to further describe success in this arena. And those guiding principles are inclusive, responsive, and resilient. What do I mean by that? First, we look to data partnerships to foster and advance inclusiveness. So does the data partnership improve the delivery and quality of service regardless of gender, of income, of, for example, pre-consisting, in light of pre-consisting conditions? Can it show us where the need is the greatest and where there are blind spots? And other panelists already talked about biases, but this speaks to biases that might be inherent or exacerbated by the combination of data sets. And that is something that the data partnership will have to manage for. The second criterion, responsive. Does the data partnership aid in the delivery of care that is truly responsive to the critical need of patients, but that also helps health workers do their job? I think other panelists also spoke to that. Can it reduce the time it takes to connect to quality care? And can it reduce the time to heal? The third characteristic of a successful data partnership is being resilient. Is the data partnership set up in a way, looking at its operating model, that it allows for the provision of longitudinal data that can be accessed by patients or providers? Is the data standardized in a way that it can be used for other services, consent permitting, so that the data storage, the collection, and the processing are really, that their value is increased? And particularly relevant, as we have seen over the last 2 years, will the data partnership and the work it's doing remain relevant as needs shift and as emergencies happen? This is obviously not a comprehensive list. However, we see being inclusive, responsive, and resilient as the key ingredients for a successful data partnership in health. What's the specific role of nonprofit organizations in all this? There is the important category of local or regional nonprofit organizations that work to hold governments, the private sector, and other organizations accountable for the delivery of equitable health. But I want in particular to focus on implementation organizations. Those are the organizations that implement at scale on behalf of governments or bilateral aid agencies in country. These organizations often generate significant amounts of data. And sometimes, as I said, they do it for governments, but also sometimes they do it in parallel to governments or in parallel to other implementation organizations. And I would like to suggest 3 things these organizations can do to strengthen good health data governance, directly contributing to the earlier principles of being responsive, resilient, and inclusive. So the first thing that I think nonprofit organizations can do is to include marginalized groups, really ensure that communities that are often unheard are involved from start to finish, from the conceptualization to the time when data is used to drive action. That also means shaping the mechanisms to control for inclusivity. Who can even detect if things go wrong?
Claudia, we have to really rush.
Yes. Second is the resiliency of the data work, and that I think speaks to the elements around helping to reduce fragmentation, contribute to government-led efforts where possible, and to expand the role in building the capacity of the health system to use and apply data. And the last one is really to ensure that data partnerships drive action that is responsive to the needs of specific groups, especially those that are the most vulnerable. These are some of the aspects how nonprofits can drive strong data governance.
Thank you very much, Claudia. Sorry for rushing you. We only have about 7 minutes left, and I do want to make sure that Njidin Dili, who is the country director for Pharma Access Foundation, can speak to us also about the role of public-private partnerships in this context. I'm happy to say that Njidi is also a commissioner in our Lancet Financial Times Commission. So welcome, Njidi. Wish I could be there. And the last 5 minutes go to you.
Thank you so much, Ilona. I was actually looking out for you when I got here. So a lot has been said already, which I don't need to repeat. But what is critical in this discussion is really who is responsible for governance? Who can you hold responsible and say, this is your role? And we find that it's actually a lot of stakeholders that need to be aligned. But yet, I think the central responsibility lies with the government. Because what we're finding, especially with our work at the Lancet and even with my work in farm access in Nigeria, is there's so many different stakeholders. And you find that there's actually more data outside of government in low and middle income countries that are within government. So the question is, how do you harness that data for public good? How do you use it to develop policy? What is the governance around that? And the last speaker talked about NGOs and the work that they do in countries. You also find that, especially for low and middle income countries, you find that the funders, the donors, most often own the data. And the data is not really, aligned. And of course, we saw the pilotitis, which is a new word for me that I have to take back. So how do we ensure that all this data is aligned and harnessed for public good? What is the governance structure around that? And I can see that even in Nigeria, with the example of the Nigeria Center for Disease Control, which was headed by Chikwe, that was a fantastic example of public-private partnership, because the Center for Disease Control was supported by quite a number of NGOs, which the world doesn't know about. We included as Farm Access, FCDO, to help develop the strategy and bringing together the activities that aligned all the different stakeholders. For example, Farm Access Foundation did the mapping to include private sector labs. The data from the labs were aligned with the National Center for Disease Mapping so that you can report really on a daily basis. So it's very important that we strengthen the capacity of the regulators, who ultimately should be responsible for the governance or defining the governance, of course, alongside with WHO. And I'm also happy there's some work being done with Transform Health to define those principles around data and the guidelines. And some of this will be included in our report, which will be launched later in the month. But it really should, governance should be around specific guidelines, serving all stakeholders with input from different stakeholders so that we're all driving towards, the central objective, after all, is SDG 3, which we have to accomplish by 2030, and we're far away from that. So data governance is very critical, very central, and we need to begin to define where this is domiciled, who has leadership over how the data is collected and governed. All the other issues around rights, equity have been discussed, but I know Elena is looking at me because we're almost out of time. So I'll hand it back to you so that you can summarize all that we've said. Thank you.
Thank you so much, Njidi, and thank you for being so precise in your messages. I think there's only 3 or 4 things I want to highlight from what we've said. I think one thing is really to keep in mind, as we heard, the question was, why are we doing this? I mean, there has to be a value-driven approach, and there has to be an understanding that what we want to do is clearly related to achieving the SDGs, and for us particularly achieving SDG 3 and improving health and improving universal health coverage. And it seems in many cases that because of the way technology drives innovation, that sometimes the ultimate goals get lost, and particularly the equity goal gets lost along the way. And I believe that is something to really keep in mind, and where these governance principles then, with equity and accessibility being a key principle, become very, very important. We've also heard how important the alignment of actors is, their involvement in governance, but the leadership role of the government, and also what kinds of incentives might need to be put in place to make that alignment possible. We've also heard that as governance moves forward, it has to be clear who can be held accountable and what mechanisms exist within governance, and these are stewardship mechanisms, that accountability is possible, that voices are heard. And we heard very strongly how much this development of a digital transformation needs to be inclusive and inclusive of many actors, but also inclusive of vulnerable people and inclusive of young people in particular, as we have also done in our Lancet Commission. And we've heard also from Samira, from WHO, from many of the other speakers that in this development of the digital transformation, we are looking at a public good. We are looking at something that is closely related to public health and its values, and that data need to be integrated into our public health systems in new ways, and that we need to find new ways of sharing data, of sticking to new kinds of ethical values that allow for data solidarity. So I think we've had a lot of points through a fantastic group of panelists, a really great introduction from Antoine Geissbühler. I hope you'll have an opportunity to maybe listen to the panel again to be able to pick out some of the really critical points that people put forward. Thank you for your time. Thank you for listening. Thank you for contributing. And please become strong advocates of strong and good global and national data governance. Thank you very much. Goodbye.
Thank you.
Thank you.